In many infectious, viral and bacterial diseases, BioMag low-frequency pulsed magnetic therapy applications are used during the recovery period after managing the acute disease, with the aim to accelerate recovery of impaired tissues and to minimize any possible consequences of the suffered disease. These infectious diseases include, for example, tick-borne encephalitis, meningoencephalitis, Lyme disease, mononucleosis, shingles, hepatitis, but also other infections such as salpingitis, inflammation of the urinary bladder, etc. Tick-borne encephalitis is a serious, life-threatening disease. This viral disease is most often transmitted by ticks. If the infection is diagnosed at an early stage and professional treatment is initiated, complete recovery may be achieved. Late initiation of tick-borne encephalitis treatment and complications of the disease can result in permanent consequences such as chronic headaches, sleep and attention disorders, paralysis of the upper extremities, decreased performance, and depression. BioMag low-frequency pulsed magnetic therapy is used during the recovery period when it accelerates the regeneration of the body, reduces development of complications, and shortens the recovery time. Lyme disease is caused by spirochete known as Borrelia burgdorferi and proceeds in 3 stages. Lyme disease is most frequently transmitted by ticks, but also by other biting insects. Treatment of the disease requires antibiotics and early diagnosis, and treatment is very important. In later stages of the disease, many clinical symptoms persist after antibiotic treatment that can pass into the chronic stage. Additional symptomatic treatment and long-term rehabilitation are important. BioMag low-frequency pulsed magnetic therapy is a suitable method for long-term treatment of the chronic consequences of the infection. Magnetic therapy may provide a positive effect on many joint issues, improve mobility, reduce pain, reduce the course of the inflammatory process, support healing, and due to its overall immunostimulating effect, reduce the progression of clinical symptoms. Infectious mononucleosis is caused by the Epstein-Barr virus and results in fatigue, fever, and throat pain. It affects the tonsils and leads to enlargement of the lymphatic nodes. The virus affects parenchymatous organs, such as the liver. Regime rules similar to those applicable to hepatitis B and C apply here too, i.e. diet, rest regime, etc. A serological test can confirm the diagnosis. The main treatment of mononucleosis is symptomatic, antipyretic, rest regime, and a liver-friendly diet. Of course, the best prevention is timely vaccination against mononucleosis, particularly in children. During the recovery period, BioMag low-frequency pulsed magnetic therapy is recommended to decrease the risk of developing disease complications and to support the regeneration of hepatic tissues. Shingles, or herpes zoster, is an infectious disease which is caused by the varicella zoster virus, a virus from the herpes virus group. Infection occurs in 2 stages. Primary infection, chickenpox, and the second stage occur upon failure of the immune system, which may cause reactivation of the virus. Then shingles are formed, most often located on the path of nerves. The most serious complication of shingles is post-herpetic neuralgia. Therapy should include antiviral drugs, anti-inflammatory ointments, vitamins, and analgesics. Vaccines are successful in particular against severe courses of the disease. BioMag low-frequency pulsed magnetic therapy can be used as part of the treatment, as it reduces pain, accelerates healing and regeneration, and provides overall stimulation of the immune system. It should mostly be applied locally to the painful location of the miliaria and also to the appropriate segment of the spine using a flat applicator. BioMag low-frequency pulsed magnetic therapy should not be applied in acute viral liver disease, but it can be used during the recovery period after the disease and in chronic liver impairment, such as after hepatitis, to support healing and regeneration processes. In approximately 10 to 12% of patients suffering from liver disease, the disease transforms into a chronic form, i.e., a form which may lead to liver cirrhosis or liver cancer. BIOMAG low-frequency pulsed magnetic therapy significantly accelerates regeneration of the liver cells, stimulates healing, and prevents further impairment. Complete alcohol abstinence and other dietary and lifestyle measures are required. These can be combined with the fluid intake program and the use of magnetized water. Another type of inflammation in which magnetic therapy is beneficial is salpingitis, inflammation of the fallopian tubes, which manifests a relatively high risk of subsequent infertility in women. Infertility is a sound reason to support the course of treatment to the maximum possible extent, particularly the final treatment stage that eliminates complications. The aim of BIOMAG low-frequency pulsed magnetic therapy is to use its anti-inflammatory and healing effects to prevent the risk of transition of inflammations into chronicity and the formation of adhesions. In inflammation of the urinary bladder, BIOMAG low-frequency pulsed magnetic therapy is used in combination with other targeted treatments, including antibiotics. Magnetic therapy reduces pain and spasms, stimulates healing, and improves the effects of antibiotic treatment. Therefore, it can be used not only during the therapy procedure, but also as prevention.